Hello students and my dear friends. In this session, we'll discuss hepatitis D virus and hepatitis E virus. So they are very small topic. We'll discuss in one session only. If you see the introduction, hepatitis D virus, it is a defective virus. So D stands for like a delta antigen, or you can easily remember D stands for defective virus or dependent virus. So it is a defective virus or dependent virus. It always depends upon the helper function of HBV. HBV means hepatitis B virus. So it cannot survive independently. So it depends upon the helper function of hepatitis B virus for its replication as well as the expression. So for its replication and expression, this hepatitis D virus depends upon the hepatitis B virus. And this virus belongs to the genus Delta virus. Next, morphology. It is a spherical shaped virus. In the picture you can see. So the size of the virus is 36 to 38 nanometer in the diameter, and they consist of RNA as genetic material. So as we discussed in the previous sessions, like all hepatitis viruses are RNA viruses except hepatitis B. So this is also like a RNA virus, but as I told you, it depends upon hepatitis B virus. So this is RNA and it is surrounded by HBsAg envelope. In the picture you can see, so this is hepatitis B surface antigen. So this RNA, it is covered by the like a hepatitis B surface antigen or envelope. So the genome is single stranded, small, circular molecule of the RNA we can see, and see it encodes its own nucleoprotein that is called as delta antigen or HDA antigen. This outer envelope, that is HBsAg of HDV, is encoded by the genome of hepatitis B virus of co-infecting the same cell. So as I told you, hepatitis B virus is necessary for the production of hepatitis D virus virion. So what is meant by virion? Infectious particle of the virus. Next, clinical features. See, the hepatitis D virus infection occurs in the presence of hepatitis B virus. So if there is hepatitis B infection, then only hepatitis D infection takes place. So what are the two situations? That is simultaneous infection with HDV and HBV. So here that is co-infection. So the patient is simultaneously infected by hepatitis D virus and hepatitis B virus. And next, super infection. So what is meant by super infection? So here it is by HBsAg carrier by the hepatitis D virus. And how the infection takes place. So the main mode of transmission is like parenteral, which means direct inoculation into bloodstream, like contaminated blood, blood products, syringes, blood transfusions. Okay. And next, another mode of transmission is like sexual contact and even vertical. Vertical means from mother to the fetus. Suppose if any patient is having like co-infection, which means like a simultaneous infection of hepatitis B virus and hepatitis D virus, it increases the risk of it increases the like a severity than the like a HBV alone. So they causes like a severe infection. So simultaneous infection of hepatitis D virus and hepatitis B virus is severe than the like hepatitis B virus. Once the infection takes place because of the hepatitis D virus, so this hepatitis D virus, it interferes with the hepatitis B virus multiplication. So that's what this virus, HDV virus, it utilizes hepatitis B virus for its replication, in its own replication. Laboratory diagnosis. So the laboratory diagnosis, it is done by detecting IgM anti-delta antibody. It's done by detecting IgM anti-delta antibody in the serum of the infected person. So for this, we can use the like ELISA kits. So ELISA kits are available for detection of antibodies to HDV. And as you know, like IgM antibody, so IgM appears early in response to the infection, which means it appears in 2 to 3 weeks after infection, and it has uh, off life of like only 5 days, which means it can survive for only few weeks. And after that, it is replaced by IgG antibody. So this takes place in the like a acute infection. So presence of IgM antibody indicates recent infection, and the presence of IgG antibody indicates the past infection. So hepatitis D A, that means delta antigen, hepatitis D Ag, that is delta antigen. So this is expressed in the like liver cells nuclei, and this HDA antigen can be detected by the immunofluorescence technique. So this is like occasionally present in the serum. And next, HDV RNA, like hepatitis D virus RNA. So this RNA can be detected by hybridization technique, like which means by using of radio labeled probe. Next, anti-HBC antibody. It can differentiate like a co-infection and a super-infection. So as we discussed, like co-infection and super-infection. So what is co-infection? That is simultaneous infection with HDV and HBV. And super-infection is like that is HBsAg carrier by hepatitis D virus. So by using of this anti-HBC antibody, we can differentiate co-infection and super-infection. So in case of co-infection, IgM anti-HBC and IgM anti-HDV both are positive. And in case of superinfection, so IgG anti-HBC and IgG anti-HDV are positive. So C stands for core. And HBsAg antigen and HDV RNA, so they show the positive in case of both co-infection and superinfection. And HBe antigen. So HBe antigen, it is a hidden antigenic component of the core. So it is present in hepatitis B virus. It is positive only in case of superinfection. So where it is, we can see in case of hepatitis B carriers. Next, prophylaxis. So here there is no specific prophylaxis for hepatitis D virus. So if we give vaccine for hepatitis B virus, so generally we give recombinant vaccine for hepatitis B virus, recombinant yeast hepatitis B vaccine. So if we give that vaccine, automatically it will give protection from hepatitis D virus. And only thing, like, we should screen properly, like for blood donors, like for HBsAg, so which limit the blood-borne hepatitis D virus infection. Next, treatment. So this infection, like this virus, it is treated with the interferon alpha, and we should give the like a treatment for hepatitis B virus also. And next, hepatitis E virus, that is HEV. So if you see the morphology, hepatitis E virus, it belongs to the family of Hepaviridae and genus Hepavivirus. So it is a spherical, non-enveloped, and it is having 27 to 38 nanometer in the diameter, and it consists of single-stranded RNA as genetic material, and it is covered by the icosahedral capsid. So in the picture you can see this is the icosahedral capsid. So this is the single-stranded RNA as genetic material. So with the characteristic surface depressions we can see, and only one serotype is present. So what is the pathogenesis? So this infection takes place. They occur in like epidemic, endemic, sporadic forms. So this is takes place especially in the like developing countries because of the like poor sanitization, and like generally like hygiene conditions are not maintained. So it is mainly transmitted by like fecally contaminated food and water, like fecal-oral route, which means if the food or water get contaminated, then it leads to the like infection. Hepatitis A and hepatitis E both are transmitted by fecal route, which means if the food or water get contaminated with fecal matter, if it is consumed by healthy individual, it leads to the like infection. And the incubation period, it varies from like a 2 to 8 weeks. So averagely it is 6 weeks. So this infection takes place in to middle-aged children. So when compared to the like hepatitis A virus infection, see this infection, like hepatitis E virus infection, it resembles hepatitis A clinically because both are transmitted by the like a fecal oral route, and the disease is mild and self-limiting, so it's need not to worry. Like very low case fatality, only 1%. So only 1% cases it leads to the like death, and it doesn't lead us to the like a chronic hepatitis or cirrhosis or like even like a cancer or carrier state. So here it doesn't cause like severe infection, and it doesn't causes like cirrhosis of liver or like liver cancer. So here, like the secondary attack rate. So secondary attack rate, like in case of household contacts, it's very low only, like that is 2 to 3% only. But if you see in case of hepatitis A virus, that is high, that is 10 to 20%. So we have seen this epidemic viral hepatitis. So this was occurred in Delhi in the year 1955. So there are like around 30,000 cases of icteric hepatitis have reported. uh, we believed that they are like hepatitis E type. So why this happened? It is because of the like contamination of drinking water, like fecal contamination of drinking water, because of the like Yamuna flood, Yamuna river flood. So that might be the like reason. And same type of epidemic occurred in the year 1975 to in between 1975 to 76 in Ahmedabad city. Next, laboratory diagnosis. So this can be identified by polymerase chain reaction, hepatitis E virus RNA. So it can be detected in the feces or in the serum of the patient, in the acute phase serum of the patient by like RT-PCR. So reverse transcriptase polymerase chain reaction. So this is the gold standard test, which means we get the like accurate results, and this is helpful for a diagnosis of HIV infection. So this test is positive even before the onset of the clinical illnesses. So even though the patient doesn't come up with the like symptoms, so if you go for the like testing, they show the positive. And next, IEM, that is immunoelectron microscopy. So in this case, generally we take the like fecal sample, and the fecal sample is examined under immunoelectron microscopy. So under immunoelectron microscopy, we can observe aggregated HEPI virus particles. So this is done by using of monoclonal antibodies. And next, serum antibody detection by ELISA test. So this is for detection of IgM anti-HEV antibodies and IgG anti-HEV antibodies. So as you know, the presence of IgM antibody indicates a acute infection or recent infection, and presence of IgG antibody indicates the past infection. So in most of the like viral infections, so in response to the like infection, first of all IgM antibody is formed, and after that in it is replaced by IgG antibody. Next, the prophylaxis. So how we can prevent this infection? So improved standards of sanitization, like hygiene condition should be improved, and like a chlorinated water, like supplying the like a chlorinated water or drinking the like a chlorinated water. So this is enough to destroy the like virus. So here, China, like they developed, like they have produced and licensed. So first hepatitis E virus vaccine, which is called as HEV 239. So this is done by using of recombinant HEV proteins. So this is available only in China. So this is not available globally. It is not in the like Indian market. Thank you.